Hello, everyone. Welcome to the Advancing Health Equity Policy Systems and Environmental Change webinar. The Nota Brigade Third Foundation is happy to partner with the American Indian Cancer Foundation on this webinar. Melanie and Donis will tell you more about their work, but before we begin, let's go over some housekeeping. 1, participant lines have been muted to avoid background noise. 2, we will have time at the end for questions and answers, but if you think of a question during the presentation, feel free to type it in the chat box. 3, you will receive a webinar recording at the end of the webinar, but if you look in your control panel, you'll see that there is a handout available. That is a PDF of this presentation, so feel free to download it and open it and follow along in case there's any pauses or any technical challenges on your side or our side. And also at the end of the webinar, we will have a quick survey, so please share your thoughts. And lastly, this is scheduled for an hour, so we will honor your time. And should there be any questions or conversations still going on, I'll be happy to receive any of those questions after the webinar, but also I believe Melanie and Donis will share their information as well in case there's any questions for them. So with that, I will hand it over to Melanie and Donis, and thank you again for joining our webinar today.
Thank you, Dakota. Good morning, participants. As Dakota shared, Donis, Chosa, and I are joining you at the American Indian Cancer Foundation this morning from Minneapolis, Minnesota, and we are going to be covering advancing health equity topics, specifically related to policy systems and environmental change strategies. Again, I'm Melanie Plasinski. I'm an enrolled member of the Bad River Band of Lake Superior, Chippewa. That's where I'm from. It's in northern Wisconsin, and I'm the Prevention and Policy Manager here at ACAF. I've been here about 3.5 years.
Good morning, everybody. My name is Donis Chosa. I'm an enrolled member of the Boys Fort Band of Chippewa, which is in northern Minnesota, but originally from Keweenaw Bay Indian Community, which is a small Ojibwe tribe in the Upper Peninsula of Michigan. I've been at the American Indian Cancer Foundation for about 4 years now, and I'm the Prevention and Policy Specialist here. And I'll turn it back over to Melanie.
So the objectives for the webinar today, by the end of the webinar, we hope participants are able to shape a comprehensive understanding of PSE change through an Indigenous lens, and also to identify promising practices, success stories, community-led initiatives, and culturally tailored prevention resources. The ACAF story. So the American Indian Cancer Foundation, we are a national nonprofit. We were established as an organization to address the tremendous cancer inequities faced by American Indian and Alaska Natives. And our mission is to eliminate cancer burdens on American Indian families through education and improved access to prevention, early detection, treatment, and survivor support. And the vision for ACAF is a world where cancer is no longer a leading cause of death for Native people. And we believe that through hard work, culturally appropriate community-based programs, and policy change that affords Native people access to the best prevention and treatment strategies, we see a day where American Indian communities are free from the burdens of cancer. So this slide, this is our technical assistance support staff, myself, Melanie, our coworker, Amanda Dion, Tequila Lightfield, and Donis Chosa. And what we do as the TA team is to support positive community change across Indian country. And some of the efforts that we provide assistance with are things like community engagement, having focused conversations or talking circle conversations, action planning, event planning, and coalition building activities. We provide both on-site and in-person training, as well as a lot of distance support and web-based support as well. Some of the tools and resources that we have to share and offer are policy systems and environmental change infographics, which are tailored to represent and be culturally relevant for Native communities. We have infographics on prevention topics such as HPV, breastfeeding as cancer and chronic disease prevention, breast screening information, and cervical cancer screening, just some examples. We also have useful, simple tools like event planning templates. We have policy templates and examples. And then it's like maybe the text is cut off there, but it's really just providing public health data for making the case for change and fact sheets that can support why the change is needed and how it can benefit the community. So this slide shows two publications on the left. We won't go into a lot of data, but just as a reminder of the trends that we are Native communities across the country, inequities, especially in cancer incidence rates, which we know vary by region and vary by the types of cancer that are most impactful in those regions. However, overall, other populations are celebrating decreasing cancer mortality rates and have been over the last 20 years, but we still see American Indian cancer mortality rates on the rise. So this slide we use when we talk about equity and what we mean when we talk about equity. First, I'll just read the description of health inequity as a health disparity based on inequitable, socially determined circumstances. And we'll get into that a little bit more later. But here, just the visual representations, we see the difference between equality and equity. On the left, every individual there has a box to stand on, to reach for the fruit and get the food that they need. However, you can see that that's not appropriate for every person. Not everyone needs the same things. We're all so different. On the right, you can see equity being every person has the right size box for them so that they can all have access to that fresh fruit. And we had the same just visual representation on the right, thinking about every person needing a pair of shoes, needing moccasins. That would be equality. Every person gets a pair, but whether or not they're the right ones for us, they fit well, they're the right style. If that's true, then we have equity. Persistent inequities. We're going to try to stay positive, but again, just reminders that we have these persistent problems facing inequities in cancer and other chronic disease, such as diabetes and heart disease. We know these things are largely related to health behaviors, so smoking, whether or not we're eating healthy and exercising, and also social determinants of health as well. What types of jobs are available, if there's opportunity for higher education or education in general, if there are safe ways for people to get transportation, would all be social determinants of health. So again, American Indians we know are too often on the worst end of every health indicator being reported. So looking at statistics like access to healthcare, environmental, air and water quality, and substance abuse. Just a couple examples we often see are people in our communities on the bad end of those statistical frameworks. We are here though because we're working together. We all want to see and create positive change and promote healthy norms in our communities to support and protect future generations. Acknowledging too that some of our health behaviors that we see prevalent in the communities aren't all that person's fault or that family's fault or the fault of the community. It's because of historically what we've experienced. Knowing our reality currently is determined by history. This quote is taken from the Minnesota Advancing Health Equity report to the legislature. It was 2014 when this was published, so it's getting a couple years old now, but we still feel like it's relevant because the state of Minnesota acknowledges that there are some systemic issues and trauma and racism existing within the system. So the quote is, health inequities are directly linked to determined and deliberate efforts of the U.S. federal, state, and local governments to uproot American Indians from their lands, eradicate their languages, and destroy their ways of life. uh, which we're acknowledging because we know this has led us to some of the behaviors and issues that we have in our communities today. What impacts our health? I just described a couple of these pieces of the pie, 30% being health behaviors, like I mentioned, smoking and eating, exercising, and then 40% is the social and economic factors, again, transportation, education, and so forth. We have 10% being impacted by our genes and biology, 10% being physical environment, and then 10% is clinical care. And we know this graphic can kind of look different depending on where you're at, but it helps us kind of provide a framework for understanding what makes us healthy and what we can change or create policy around to see positive change happen. So in talking about the social determinants of health, as I mentioned, there are factors that are existing in communities that support or do not support people to be as healthy as they can possibly be. We know that there's opportunity to advocate for change around these things, to see, for example, new recreational equipment available for community members and spaces that are safe to exercise in, or gardens where people are able to access and become familiar and comfortable with healthy foods that we once had, those indigenous ways that we once had. And also, basic things like transportation. Are there walking paths? Can you bike safely, or are you walking on the road, which is a little bit more dangerous? So really, this is about the environment around us. And then the 30%, so specifically this one's related to our main topic today and looking at nutrition and beverages and what types of beverages we're taking into our bodies. This is the 30%, so health behavior. If you're consuming one sugary drink per day, I'm sure many of you know this information already as this is your focus, but one drink per day increases your risk of overweight and obesity by 55%. It increases your risk of diabetes by 26% and tooth decay 30%. So we're going to be talking more this morning about policy systems and environmental change strategies and looking at those as really an upstream approach to addressing social determinants of health and chronic disease prevention. We know the Water First grantees are a great example of communities using an upstream approach to prevention by implementing PSE strategies, and those being so different depending on where you're from, but things like increasing access to consumption of safe drinking water and promoting breastfeeding being important means of prevention and bringing health to community, and also utilizing community-led sustainable solutions to improve the health of your communities, which is wordy, but just trying to get at, we know that the wisdom lies within the community, and the types of strategies that you pursue is because that's what's really relevant to your communities and what's accessible as far as making change happen. So we talked about existing historical realities for us, current reality, some of the inequity data, and some of the impacts on our health. And the question is, what can be done when we think about this? And we know it's time for change, and we know there's energy out there for people to shift norms from things like providing soda at meetings and events, and intentionally moving away from that and moving away from unhealthy products with the aim of a gradual adoption of policies and norms and behaviors that support individual and community well-being with healthier options, and people not only being aware of but wanting to choose those healthier options. So now moving on into, first we'll talk about definitions of PSE change, and how it's relevant when we think about it through an Indigenous lens. And then we will get into some examples and success stories that we've learned of and that you all may be familiar with. So we just want to mention before we get into these slides that when we first started thinking about PSE change in Indian country, it's a very public health jargony term, and so we went back and forth and developed this material with input from some of our elders and mentors and other people working in the field of public health, Native people, asking them if it made sense and if it resonates. So we hope that it does, and if you all have feedback on these definitions or what it means for you, please share with us. So PSE change defined, making changes at the policy systems and or environmental level to affect a broader impact in advancing health and achieving health equity. The American Indian way of life. We included this slide because we're wanting to acknowledge that the worldview that many of our communities operate from is different than the mainstream worldview, where tends to be less linear from point A to point B and more cyclical and balanced, where there's connectedness to all living things, respect for life, and respect for each other. And we tend to operate in a more collective way versus individualistic, which tends to be more of the Western worldview and competitive and thinking about what can we get to accrue wealth for our families. We tend to think more of a community, have more of a community mindset. So first, looking at policy change through an Indigenous lens, the public health definition states that these are changes in rules that encourage or discourage a certain behavior. So that's pretty straightforward, but again, may not resonate with a lot of people working in communities. So with the Indigenous lens, we're thinking about policies as just guiding principles for ways of life. It can be that simple. Thinking about our teachings for respecting your elders, not taking more than you need when you're collecting or harvesting food, things like that, and showing appreciation and respect for all living things. Thinking about systems change, the public health definition states that these are changes of how things are done at an organization or setting. That's pretty basic, and the connection that we make to the Indigenous worldview is thinking about systems as building blocks of a community that allow it to function as a whole. So types of systems we've had are family systems, clan, band, however you identify yourself as being a part of something. The system of food system, water and medicine systems that exist in the communities, and then also tribal government and tribal departmental systems. Environmental change. The public health definition states that these are changes in the places you live, work, play, shop, and go to school. That makes sense to me. And then also adding what it means through an Indigenous lens, we're thinking about the natural and built world around us and how we're interacting with it. So planting gardens and doing education and awareness in the gardens and fertilizing the land when you're taking from the land, and also harvesting the natural foods that grow if you have those. Environmental, also thinking about just seasonal practices culturally, and then also infrastructure, so sidewalks and playgrounds and the built environment in the community.
That's fine. I can just have you turn it.
So now I'm going to ask Donna to continue sharing a little bit more about PSE and going into some approaches and success stories.
Thanks, Melanie. Just a reminder that if you have any questions, feel free to ask in the chat box. But now that we have a better understanding of some of basic PSE, We'll get into some examples like Melanie said. So this slide here just shows examples of PSE approaches compared to more common approaches. With PSE approaches, we want to remember that the goal is to create more sustainable, impactful changes in our communities. For example, in the school setting, it would be a common approach would be to teach a unit on healthy beverage consumption, and the PSE approach would be to actually provide healthy beverages at lunches and in vending machines, and then also limiting the amount of uh, sugar sweetened beverages on school campuses, and then increase access to water stations. From here on out, we'll be using SSB in place of sugar sweetened beverages. Um, in the work setting, a common approach would be educating on impacts of SSBs to our health. And then the PSE approach would be to develop a policy to reduce SSB consumption to create healthier work environments, and then providing healthy beverage options at meetings and conferences. For the community setting, a more common approach would be to provide education on benefits of breastfeeding, but a PSE approach would be to create safe, accessible spaces for women to breastfeed at events and community gatherings, and then removing advertisements for unhealthy beverages in local stores and or vending machines. Next slide. So at ACAF, we've developed a resource for PSE change strategies and their potential impact specific to our communities. And just a reminder that this isn't an all-encompassing example, but just to provide grantees a model, and that this can be tailored to your needs. We recognize that these are broad approaches, but it's definitely what is needed to bring about changes within our communities. So the PSE strategy would be policy, and a description would be limiting the distribution of sugar sweetened beverages at tribally sponsored community events and gatherings. For systems, they would be implementing preventative screening measures in clinic and hospital settings for people who are pre-diabetic, overweight, or at risk for other chronic diseases. And for environmental approach, it would be providing opportunities to access safe and free water in public areas and at community events, or convening with the impact of decreasing in excess morbidity and mortality related to obesity and diet related illness, which would be the impact for all of the PSE as a whole. Next slide. So we're not going to get into depth about tribal sovereignty, but we do want to acknowledge that we're a sovereign people and that we can use this to create positive and healthy changes in our communities. Tribal sovereignty, meaning that federally recognized tribes are recognized as possessing certain inherent rights of self-government and are entitled to receive certain federal benefits, services, and protections because of this unique relationship with the United States government. So this is an important federal policy because it gives our communities the unique ability to create our own policies and systems that have the most effective approaches and impacts to making our communities healthier. And now we'll get into some more promising practice examples. So these are just policy strategy examples. Some of these may be similar to what you're already doing within your own work. For instance, at meetings and events for community and staff, an example would be no sugar sweetened beverages to be served or sold at community and staff events sponsored by the organization or tribe. At educational, youth, and child care institutions, an example would be prohibiting SSBs during youth program hours and in early child care classrooms. For vending machines, an example would be requiring 75 to 100% of beverage products sold in vending machines. And then in retail businesses, an example would be setting age requirements for purchasing energy drinks and SSBs to protect children and young adults. Marketing and sponsorship examples would be prohibiting SSB marketing on property such as vending machine panels, scoreboards, banners, signage, and equipment. These examples were taken from a resource that is currently being developed in partnership with NB3 and ACAF, which we'll kind of talk about later on. Next slide. So these are more strategies for success, and these include placing signage, as we kind of talked about earlier, placing signage in visible areas to inform employees and community members, providing access to water bottle filling stations and drinking fountains, making reusable water bottles available within gift shops, stores, cafeterias, and at community events. Hosting community engagement events to provide awareness, along with setting up booths at health fairs to spread awareness and education on why change is important and necessary. Having clear steps for enforcement after developing policies, having a media campaign for community outreach, and then completing an evaluation. And this can be before and after policy implementation. And have fun. So we'll get into some community success stories, and we can go to the next slide. So an example of a success story, I guess, would be our health and wellness policy here at the American Indian Cancer Foundation. And that basically says to choose Indigenous and local as a first choice when serving food. For example, we use the place is called Gatherings Cafe, which is an American Indian owned cafe that serves healthy Indigenous foods, and we usually use them when we have our meetings or events here in the Twin Cities. Follow the recommended portion sizes according to current nutritional guidelines. Choose healthy over less healthy choices. Avoid serving sugar sweetened beverages at, like, let's say staff meetings or meetings with funders and things like that. And not allowing employee reimbursement for the purchase of sugar sweetened beverages. We do this because we recognize that the causes of cancer for American Indian communities are attributed to a few leading risk factors such as diabetes and obesity as a result of our diets that are higher in sugar and less in fruit and veggies. So this policy was implemented since ACAP has started, but we just want to stress that we understand that it is a learning curve, especially when we have new staff that are coming on board. But we believe that we should model these cancer prevention strategies within American Indian communities, and I think that's important. Yeah, go.
I was just going to add that since I started, this is Melanie speaking, the policy was in place, but we just recently added the piece about disallowing employee reimbursement for sugar sweetened beverages. And as that was a new policy, I got to see kind of how well people adapted to it. We are a relatively small organization, but growing pretty quickly. And as a manager of staff, I've had people accidentally purchase sugar sweetened beverages, such as like coffee drinks, not really thinking about the sugary syrup that goes into those. But it's not really about punishing somebody for doing something wrong. It's just a reminder that you can choose a healthier option if you do want it to be covered by your work expenses, which is nice, and most people will opt into that, I've realized. Also, we are going to be adding a provision about disallowing reimbursement for artificially sweetened beverages. And I think this is a little bit, or can be, depending on where you're at, a little bit more of a controversial topic, because we know so many people enjoy those beverages and they are used to consuming them either because they are pre-diabetic or diabetic, or they just enjoy those beverages. But as the Cancer Foundation, we can sort of point to the data just having mixed results as far as whether or not some of those artificial sweeteners are healthy or if some of them are cancer causing. We know some of them are cancer causing. We don't think there's enough research to support saying that those artificial sweeteners are healthy. So I just want to add that.
Thanks, Melanie. Now we'll show a short video that features one of our ACAP staff members, and she's talking about our policy here.
one where we all have access to healthier food options in all walks of life. Native Americans were once like the healthiest people. Now we're seeing higher rates in diabetes, obesity, all these risk factors for cancer. American Indian Cancer Foundation has implemented a healthy eating policy where we have healthy foods at all of our events, even in our staff meetings. Food is something that's very important to the American Indian people. When we get together, food is always present. I think people really need to be aware of what they're putting into their bodies. Food should be something that gives you energy. It makes you feel good. Our mission is to reduce cancer, and we know that healthy eating can reduce your cancer risk. If we want to share that healthy eating is important, we need to really be able to model this behavior and walk our talk. My hope is that our healthy eating policy will continue to grow and evolve, and that other organizations will join us by implementing a healthy eating policy of their own. I'm Neely Snyder, and I believe a healthy community is a strong community.
And we can go to the next slide. So now we'll get into more examples. These photos here, this is an example of another tribal community that we've worked with to help implement a healthy and indigenous vending policy. In the first picture on the left, only pop is available that you can see, and you can even see the marketing strategy here is to promote those sugar sweetened beverages. After the policy was implemented, you can see on the right that many more options, including waters and fruit juices, are available. This particular community that we work with chose to go with a 75% healthy and indigenous vending policy, as well as making sure placement and pricing was used to promote the more healthy options. So you can see the healthier options are at eye level. Today, by providing and showcasing healthier options, the youth in their community see this as a norm and a more normal part of their everyday lives, which is basically one of our ultimate goals for these communities. Next slide, please. So these next slides, we actually used some of the information that was provided from the MB3 website to determine what the work you do as Water First grantees and how it relates to PSE change. So basically, we'll be asking you if any of you can identify what PSE approaches these are. So for the COPE community outreach and patient empowerment, the PSE strategy that you use is seeking to increase safe drinking water among families with preschool children. And we were just wondering if anybody would be willing to share what they think is a PSE approach. It could either be policy, systems, or environment, or a combination of 2 or 3 of the options. Yeah, and you can type that in the chat box. Does anybody have any idea of what PSE approach the first one could be? Or the second one? I can see that they're both labeled number 1. That might be a typo. But the second one is in 2015, Tribal Council passed Healthy Dene Nation Act with a 2% tax on junk food and tax exemption passed for healthy food sold in Navajo Nation. So I'll give the answer to the first number 1, which is an environmental PSE approach. Can anybody guess what the second number 1 is? And somebody said policy, and that's right. And actually, this one incorporates all 3: policy, system, and environmental change. Okay, go to the next one.
Looks like several people said policy, so they were correct. And I just wanted to add the first number 1, thinking about increasing access to safe drinking water for families, why that would be an environmental change. and looking to implementing or putting in place those refillable water stations, and also just providing drinking water to youth programs, after school programs, and having that available. The kids see it's available, families see it's available, and so when you're thinking about the environment around you, that's why it makes sense that it's an environmental change.
So some of the PSE changes that the five, and I apologize if I say this wrong, but the five Sandoval Indian Pueblos, Inc., their PSE change strategies, number one is increasing access to healthy beverages in WIC communities, and then two, increasing access to healthy foods in local food stores. Does anybody have an idea of what PSE strategies these include?
So we had some people respond that it is an environmental change.
Number two.
Number two, being increasing access to healthy food would be an environmental change. And increasing healthy beverages would also be an environmental change.
Systems.
Systems? And
Do you see it? We might be getting a little bit of a lag.
oh, okay. Someone also said systems change, which makes sense as well. It could be a systems change as well to increase access to these healthier options. Thinking about the food system that exists in the community.
Yep. Next is the, and again, I apologize if I'm not saying these correctly, but the GEMES Indigenous Action Policies and Practice Project. Their PSE approach is wellness, number one, wellness policies, promoting breastfeeding in workplace, and then number two, eliminating or reducing sugar-sweetened beverages in the workplace. Can anybody have an idea of what PSE approach these changes may be? Did that one just come? Yeah.
So someone shared that it's a policy change, and thinking about wellness policies, it definitely requires some language to be written and put into place about sort of what designated areas there are, if there's access to a sink, and all the things that are needed for healthy breastfeeding. ACAS just developed, in partnership with the Public Health Law Center, a breastfeeding policy for our organization. And we have a lot of policy language available if any of you are interested in looking at implementing a breastfeeding policy. Also, I apologize for the quality of this photo if it's coming across pixelated, and it's disappointing because we had a really amazing family photo shoot to promote breastfeeding in communities, and have incorporated some of those photos into our infographic, which we'll highlight a little bit later. Looking at eliminating or reducing sugar-sweetened beverages in the workplace could also be a policy initiative in disallowing the purchase and disallowing reimbursement for sugar-sweetened beverages.
And then another example that we have is the Mescalero Apache tribe. And their PSE change would be, and I'm not sure how to say this, in the day farm agricultural initiative, and then number two, building consensus to support policy and legislative remedies to regulate, reduce, or eliminate sugary beverages in their communities. And if you could share what you think might, what PSE approaches might be.
A little more information, I think, to support number one. It sounds like the tribe, based on the description we have, the tribe established a 4-H club and a Boys and Girls Club under the Mescalero Youth Development Program. And then they also developed this agricultural initiative. So number one, those two things. What types of changes would those represent? Someone responded systems, which is correct, and thinking about implementing or developing agricultural initiatives. It would definitely be a food systems change. And then the environmental as well is something that would now exist in the community for people to see and interact with.
So another example would be the Zuni Youth Enrichment Project. One of their PSE strategies is to promote and increase access to water on the reservation and reduce the consumption of SSBs, and then 2, provide drinking and filling stations at the future youth community park and creating ease of access for community members.
So a little more information we have that they're acknowledging childhood obesity and during their program planning, with that being a major issue in the Zuni community, with SSB playing a large role, as Donna said. Project aiming to promote and increase access to fresh drinking water. This is our last example to share, but number 1, we were thinking that this is a systems change to promote and increase access via education and possible policy change in reducing SSB. And then the environmental changes with number 2 and the filling stations, and also systems change in increasing overall youth access.
Thank you, everybody, for participating in that. Next, we'll get into some of our resources that we have available. And we have most of these resources available on our website, which is www.acaf.org, AICAF.org. You can go on to the next slide. I think we'll have that
at the end.
Yeah, at the end. So here is our Healthy Eating for Strong Native Communities infographic. It details different healthy eating PSE strategies throughout a community. So if you're looking for more PSE ideas related to healthy eating, this would be a good resource for you.
And we also, just as a note, we're aware that the way this community looks is green and there's water in Buffalo. This isn't representative of every regional community by any means, but it is something to use as a reference, and we have developed alongside a designer and some others who have informed us on cultural specifics, a Southwest infographic for tobacco, if you're interested in that at all. It looks different in color-wise and strategies, but that's available too.
Another infographic that we have available is the Mother's Milk Medicine for Cancer Prevention. And this is about breastfeeding and how it is cancer prevention, and that's available on our website as well.
You could also request print copies. We're happy to mail them free of charge, unless you want a large quantity, but at no cost we can mail you some resources if you'd like.
And then we have toolkits available online as well. This one is related to healthy native foods and can be a reference tool to help plan healthy meals for staff meetings and community gatherings.
Yeah, and this tool has some listed menu options for all of the food groups, and it's pretty accessible, as some recipe ideas and pretty helpful guide.
And we have webinars available as well. This one here is healthy indigenous foods policy work in the Lower Sioux Indian community, which is one of the communities that we work with to make PSE changes in their community.
I'm going to say a little bit more about that one. That was viewed, I think, over 300 times on the website. It is really interesting, and it's about a lot of the changes that they're making in their community around healthy food and healthy beverages are really progressive. And so ACAF worked in partnership with them to develop and pass some laws and policies that were also reviewed by an attorney at the Public Health Law Center, as well as their tribal attorney. And then we presented together to tribal council, but it included things like vending machine changes. So we talked about the 75% healthy options change, And we have some resources in language around that if anyone's interested in learning more about that. They also are going to now disallow sugar sweetened beverages at meetings and events. And they want to have healthier options for people who are employed by Jackpot Junction Casino because there are so many people in the community employed there, and they want to make sure there are healthy options. And also, they are providing incentives for healthy vendors at their big summer powwow this year. So a lot of exciting changes, and it's a really good webinar. Just wanted to add that. A little bit, yeah. So we mentioned earlier that there is a healthy beverage toolkit for Native communities. Putting policy into practice is a resource that we're working on that Donis mentioned earlier in partnership that has lists of strategies and sort of planned steps for implementation, helpful tips on enforcement, some more success stories, and other useful things. So we're looking forward to sharing that with you all and to broader communities out there to support healthy beverage change work. The formatting got a little odd on this slide, I think, but this is our address in Minneapolis, Minnesota, my email, Donis's email, and our telephone numbers. Feel free to reach out to us at any point to request resources or assistance that we could provide at any time. And then she mentioned our website.
I can type it in the chat.
www.americanindiancancer.org or AICAS.org. So we have one question. Now we have some time for questions, so feel free to let us know what those may be. The first question we received is, I work in California on a CDC grant for PSE changes for chronic disease prevention in Indian country. I love your presentation and I would like to know if you could share. I would like to know if you could share some of the resources you talked about in the beginning, i.e. PSE infographics that have been culturally adapted, policy examples, and culturally adapted HPV cancer resources. Yes, absolutely. We can share those resources. They are available on our website in PDF forms, which should be easy to download, but we could also email those to you if you reach out to us, or to Dakota or NB3, and we'll make sure we get you those, and we can include infographics as well as policy templates if that would be helpful. Thank you for the question. If there are any other questions, it sounds like there are some questions coming in via chat. Just so you know, we cannot hear on our end, so please use the chat feature. Someone shared, very nice presentation. Thank you. We enjoyed providing the information and are happy to chat more at any point if you'd like. Thank you. There might be a little bit of lag time, so we're going to hang on the line for another couple of minutes to see if there are additional questions.
I'm finding that in the There's another question of I'm finding that in a lot of the communities doing projects they are not quite ready to adopt PSC changes. The education program needs to be in place first. How do you recommend trying to encourage a blend of typical approaches versus PSC approaches?
So I think something that we have found that works well is to have those community engagement events where we invite in a speaker who is maybe someone somewhat known or just of interest from outside of the community. We've heard people say that draws more people in. So we brought in like entertainers who have a mindset for health to come in and speak about a topic and get people there and provide food, healthy food, and get people engaged, and then asking them to respond to something, even if it's simple. Like we've had community respond to what does a healthy community look like 4 years down the road, and have them provide drawings or words to share, and we put those together in a way to share back with the community. There are other things that we have done upon request is to do informational or just conversational interviews with either leaders or tribal leaders or community members, and just finding out what the readiness level is and why there may be some barriers. And of course, doing that in a respectful way, knowing levels of readiness vary from community to community. But those are just two examples. I would say if additionally, maybe having a focus group or just a small community meeting where you can invite people to come and respond to a question or a set of questions about what's important to them as far as the health of the community, what they want to see youth doing, and to protect and promote their health for future generations. Like you can come up with creative questions for people to connect to, I think, and then you can get some really rich information that could support why PSC change would be a good strategy.
Again, thank you all for your time. It was nice to share this presentation with you all and continue the good work.
Thank you for participating. Take care.